Hi, it's Dr. Grant Pagdin. An embarrassing problem for a number of women is the complaint of mild urinary incontinence. You know, when you have a little bit of a leaking of urine when you cough or sneeze or laugh or jump, and when you can't quite make it to the bathroom on time. Did you know that a very simple solution to this problem is now available using your own platelets? Platelets contain a variety of growth factors which can be used to help to stimulate collagen fibers, elastic fibers, and even muscle. Here at Pagdin Health, we have developed a technique for injecting platelets directly around the urethra. There's a little muscle sling that sits just underneath the urethra, and this area can be rejuvenated and strengthened with injections of platelets. We prepare these platelets using a sample of your blood, very similar to having a lab test where blood is drawn from your arm. Now, we provide you with a topical anesthetic that you put around the opening of the urethra, and then I will inject a tiny amount of anesthetic called lidocaine. You would be in a position for this procedure which would be similar to doing a pap test. Then, when I come to inject the platelets around the urethra, this procedure will be essentially painless. Many people start to report some improvements after just the first week or two of having an injection. But we do recommend a series of 3 treatments, approximately a month apart, to achieve lasting benefit. Please call Pagdin Health if you're interested in more information about how platelet-rich plasma can be used to treat urinary incontinence.